No me aparece. Hi, the team members are Carolina, Bárbara, Sofía, Priscila, Javier, and me, Valeria. And we are going to talk about the skin cancer. Okay, skin cancer is the out of control growth of abnormal cells in the epidermis, the outermost skin layer caused by unrepaired DNA, damage that triggers mutations. These mutations lead the skin cells to multiply rapidly and form malignant tumors. There are different types of skin cancer. The most risky one maybe is the melanoma because it's is developed in the cells and that produce melanin, that is the pigment that gives the color of your skin. So probably it's the most serious one.
The two main causes of skin cancer are the sun's harmful ultraviolet rays and the use of UV tanning beds. The good news is that if skin cancer is caught early, your dermatologist can treat it with little or no scarring and high odds of eliminating entirely. Often, the doctor may even detect the growth at a precancerous stage before it has become a full-blown skin cancer or penetrated below the surface of the skin.
Now we have its prevention. Um, we all know that all types of cancer must be prevented at all costs, and in this case, skin cancer should not be taken lightly and must certainly be prevented, as it can bring many harmful consequences to health, such as metastasis, which implies that abnormal cells reproduce and end up contaminating other areas of the body, including bones, lungs, and brain. In addition, if prevention measures are not carried out and cancer is contracted, and also if we don't locate in time, it could unfortunately cause the person's death. Preventing this type of cancer is quite simple. Some of the measures we can take to avoid contracting skin cancer are applying sunscreen constantly, using sunglasses with UV protection, and going to a doctor regularly to check that everything is in order. Now that we know how to avoid this deadly disease, we must take care of ourselves as best as possible and always go to a trusted doctor to make sure we are taking care of our health.
Statistics. There aren't a certain number of persons that have skin cancer, but about 1,000 cases of skin cancer occur in Mexico each year. Also, according to the UNAM research, skin cancer ranks second in frequency in Mexico. And also, a few years ago, it was common in people over 15 years of age. Today, thanks to the greater exposure to the sun and the habit of going to tanning beds, it's possible to observe the disease from the age of 18, with the great cost that it implies. Now, we need to know that in the General Hospital of Mexico, Eduardo Lisiaga, it was explained that this hospital received about 2,000 cases per year with this condition, of which 1,200 correspond to malignant tumors of different degrees. An interesting fact is that according to the World Health Organization, the point that skin cancer is the most frequent in human beings, since 2 million new cases are diagnosed worldwide every year. In Mexico, it occupies the first place among men and the third place among women. And also we need to know that in Mexico it's increasing and there are a big difference in 2016 to the year 1998. It increased 80% in mortality over the 90 years. And other fact is that the less malignant cancer is currently curable, such as basal cell carcinoma, where surgery cure rates around 90%, epidermoid carcinoma with 73%, and the melanoma cancer, which has the less chance of cure, and especially if diagnostic and advanced stage.
Now with the factors. Much of the damage to DNA in skin cells results from ultraviolet radiation or UV radiation found in sunlight and in the lights used in tanning beds. But sun exposure doesn't explain skin cancers that develop in skin not ordinarily exposed to sunlight. This indicates that other factors may contribute to your risk of skin cancer, such as being exposed to toxic substances or having a condition that weakens your immune system, etc. Risk factors. There are certain characteristics a person can have that would trigger this illness, making them more prone to get skin cancer, such as fair skin, regardless of your skin color, skin that burns, freckles, reddens easily, or becomes painful in the sun, sunny or high altitude climates, excessive sun radiation or radiation exposure, certain types and a large number of moles, a family history of skin cancer, a personal history of skin cancer, and older age.
Now, last but not least, we have the treatments. For the treatments, we know that cancer care today is much more precise than it was years ago. There are different types of treatment for patients with basal cell carcinoma, squamous cell carcinoma of the skin, and acne keratosis. There are 8 types of standard treatment that are used that we know. First, we have the surgery, that is the primary treatment for most skin cancers. For patients with basal cell or squamous cell carcinomas, a dermatologist or other qualified doctors may perform an outpatient procedure using a local anesthetic. In another type are the Mohs procedure that is done by a surgeon with a special training. First, the surgeon removes a very thin layer of the skin, including obviously the tumor, and then check the removed sample under a microscope. If cancer cells are seen, another layer is removed and examined. For the other 8 types of treatments that are known are the radiation therapy, the chemotherapy that is the most known, the photodynamic therapy, the immunotherapy, the target therapy, the chemical peel, other drug therapy, and for another extra data is that most wounds take 1 to 3 weeks to heal. If a large area of skin was removed, you may have a skin graft. In that case, healing may take longer. Some soreness around the side of the wound is normal according to doctors. Thank you for your attention.